Hello, I'm Dr. Thierry Hertoghe. I'm the president of the International Hormone Society, which is based in Brussels and is probably the third most important endocrine society for physicians. And it's a society open to all physicians, not only pure endocrinologists or hormone therapists, all people who are concerned about the importance of hormone therapy for their patients. And I'm going to talk about hormone deficiencies within the reference ranges. What is reference ranges? When you go and do a lab test for a hormone, the lab presents your value, your level of hormone with just beside it a reference range, and it's from, let's say, 1 to 3. Now, the reference range, what is it based on? Are these health values? It's not health values. Many physicians, and thus many patients, think these are optimal health values, so if you're within, everything's okay. If you're without, everything's not. No, the reference range interval is very large. Between the upper limit and the lower limit, there's a big difference. And we need actually to have an optimal value within that reference range. That is, in general, for most hormones, recent studies have shown this, it has to be in the upper half of the reference range or the upper third of the reference range. And we have data to back that up. The International Hormone Society has a website, and for instance, Consensus 9 on hormone therapy, on the thyroid function, shows you all the references where it shows that you need to have optimal values for your thyroid hormones to be healthy, or you have an increased risk of disease and even of mortality, although you're still within the reference ranges. So it is important that physicians be conscious that the patients can have a hormone deficiency within reference ranges, and that we have to strive for optimal health values. And how can we find the optimal health value? Because other studies have shown for the thyroid test, actually, that each patient has his own optimal reference range, and that the hormones fluctuate between a more narrow range. Well, how do we find it? Well, we need also to look at the clinical signs and symptoms. That means the physical signs and the complaints a patient must have. He must be absent of complaints of having too much or too low hormone, and he must have no physical sign of deficiency or of excess. And with some lab tests, values in the upper half of the reference range somewhere, will probably find for every person his own optimal health value. And this is particularly important for thyroid deficiency. There's much more mild degrees of thyroid failure than thought. Initially, it was thought that only 2.5% of the people have a deficiency in thyroid hormone. This is not true. At least 30 to 40% of the people may have some sort of mild degree of thyroid failure, and it's worth to treat. The first thing is to do an optimal clinical examination, but also to be able to interpret the thyroid test of laboratory at optimal ranges and not just pure reference ranges. I thank you for your attention.